being with us here today on our Patient Day of Advocacy for Safety Over Profit. My name is Joana Bencomo. I am the Executive Director for New Mexico Safety Over Profit. And before anything else, I want to start this by saying that this movement always starts with one thing, with directly impacted New Mexicans. The patients, survivors, and families whose lives have been forever changed by medical malpractice. People and families living with the lifelong consequences of a healthcare system that far too often prioritizes cost-cutting strategies over patient safety and access. Many of the people beside me today have experienced the unthinkable. Some have lost loved ones, they have lost children. They are all living every day with the physical and emotional consequences of preventable medical errors. All of them showed incredible courage by being here and sharing their stories today. Everyone here is from a different walk of life, from rural New Mexico, from our biggest cities, different races, political beliefs, cultural backgrounds. They are all showing us here that patient safety should not be a partisan issue. Their stories are the reason we do this work. They humble us, they break our hearts, and they fuel our determination to fight for something better. If you are a survivor, a family member, or someone directly impacted by the negligence of multi-billion-dollar corporate hospitals and big insurance companies, we see you, we honor you, and we are so grateful that you are here. I'd like to ask everyone to join me in a round of applause for yourselves and for each other and for all of us here today. At New Mexico Safety Over Profit, we are ready to fight for justice, for safety, and for accountability. I want to make something very clear. This is a justice movement. The people most likely to experience medical negligence are women, Indigenous women, Black women, women of color, children, the elderly, trans, and queer people. We are here to support all New Mexicans, victims and survivors, hold these corporations accountable, and push for policies that put people before profits. Because healthcare should be about safety and healing, not about protecting the corporate bottom line. Today, you're going to hear directly from people whose lives have been changed forever by medical harm. Their stories are why this fight matters and why we will be in the roundhouse the rest of the day and the rest of the session. And you know what? Yes, we will even be at a special session if that happens. First up is a dear friend, Rachael Lorenzo.
Hello, my name is Rachael Lorenzo. I'm the founder of Indigenous Women Rising. I'm a proud Mescalero, Apache, Laguna Pueblo, and Chicana mother. I'm here today because I learned about the stories of other patients and families who were harmed. And I recognized an incredibly painful pattern, one that so many Indigenous families in New Mexico know all too well, and I felt called to share my story. In December 2013, during my second trimester of a deeply wanted pregnancy, I went to the emergency room at Loveless Women's Hospital in Albuquerque. I was experiencing severe back pain, nausea, and spotting. I was scared, but I believed I was going to a place where people would help me. Within minutes of arriving, I began hemorrhaging and having contractions. I was bleeding heavily. My pain was getting worse, and at one point, I began to lose my vision. I knew something was very wrong, and I was terrified for my life and my baby. And still I was left waiting. For hours in a hospital room, exposed, untreated, and in crisis, I asked for help. I tried to explain what I was feeling, and I tried my best to advocate for myself, but my pain and my fear were not taken seriously. Instead, I was told that my weight limited what they could do about my pain. My questions about what was happening to my body and my pregnancy were dismissed. A doctor refused to talk to me about my options and only focused on stopping the pain rather than explaining what was happening or what it meant. I felt like I was disappearing in front of people who were supposed to care for me. I was afraid I was going to die, and I felt completely alone. Eventually, an overextended OB/GYN stepped in and provided the care I needed in that moment. But by then, the trauma had already happened. No one of any background should have to beg to be treated like a human being in a medical emergency. No one should have their concerns dismissed while they are hemorrhaging. No one should feel like their body, their life, and their pregnancy doesn't matter. As an Indigenous person and as a queer parent, I cannot separate what happened to me from the larger realities that my community face in healthcare systems. We know the statistics, and we know we are more likely to be dismissed, more likely to have our pain minimized, and more likely to experience poor outcomes. When I started hearing other families' stories, especially stories connected to the same exact hospital, I realized this was not about me. There is a pattern of harm, and patterns like this have to be acknowledged and addressed if we want to prevent more families from going through this. And accountability is part of that. Listening to patients is part of that. Making sure hospitals and healthcare systems cannot ignore harm or hide behind corporate protections. I'm sharing my story not because it's easy, and it has never been easy to share this story, but because I don't want another Indigenous parent, another pregnant person, another family to feel the fear and the helplessness that I felt in that hospital room. We deserve to be heard, we deserve to be believed, and we deserve a healthcare system where our lives are treated as precious, because life is precious, and not be treated as problems to manage or dismiss. Thank you for listening.
Next up, I invite Aleta Tweedy Suazo.
Guatzi Haupa. Hello, everybody. My name is Tweety Suazo. I'm a lifelong New Mexican and a member of Acoma and Laguna Pueblo. I'm also a board member of New Mexico Safety Over Profit. I'm here today not as a policy expert, not as a lawyer, but as a wife who lost her husband because of medical malpractice. Nothing prepares you for that kind of loss. You trust doctors and hospitals with the people you love the most. You believe they will do everything they can to keep them safe. And when something goes wrong, especially when it's preventable, your world changes forever. After my husband died, my family and I had to navigate not only grief, but a complicated and painful legal system just to seek accountability. Even under current law, it was hard, it took strength, and it took strength that I didn't even know I had. It took time, energy, and resources at a moment when all we wanted to do was born. And I've learned that for many families, especially in Native communities, rural communities, and for veterans, it can be nearly impossible to find legal help in the first place. Not because the harm isn't real, but because the system is already stacked against patients and their families. Now we are seeking proposals that would make that path even harder. These proposals would limit how juries can hold corporations accountable when they cause harm. They would make it more difficult for families like mine to find an attorney willing to take a powerful insurance company and billion-dollar hospital systems. That's not justice. That is not accountability. When my husband died, no amount of money could bring him back. But accountability matters. It matters because it tells families that their loss is seen. It matters because it pushes hospitals and corporations to do better, to be safer, to make changes that protects the next patient and the next family. Without accountability, mistakes get buried, harm gets minimized, and patients and their families are the ones who pay the price. In Native communities, we already face barriers to healthcare access. We already travel long distances for care. We already know what it feels like to be overlooked or ignored in medical systems. Weakening patient protections would only deepen those injustices, not just for Native families, but all families across New Mexico. I'm here today because I don't want another family to go through what mine did and then be told the system won't fully acknowledge them. I don't want grieving spouses, parents, children to be shut out of justice because corporations have more power than patients. We deserve a health care system where safety comes first, where accountability is part of how we improve care, where families who are harmed are treated with dignity, not as obstacles to corporate profit. That's why I'm proud to serve on the board for New Mexico Safety Over Profit. That is why I'm sharing my story, and that's why I will keep speaking up for my husband and for every New Mexican family who deserves it. Tawa, thank you.
And next up, we have Valerie G. And Dylan.
And my son Dylan. Good afternoon, everyone. My name is Valerie G. I am here today as Dylan's mom. He is now 13 years old. Back in 2015, our son was 2.5 years old. He was full of life, running, talking, jumping. The night before everything happened, he was literally jumping in the swimming pool. Then the next morning, we went in for a procedure. During what was supposed to be a routine cardiac cath procedure, Dylan suffered a spinal cord stroke, an ischemic brain injury. In a matter of hours, our life was changed forever and never will be the same. Our little boy was left paralyzed. He lost all abilities. We were told he would never eat, never speak, never walk again. Thankfully, Dylan proved some of those predictions wrong. He can eat, he can speak, but he will never have a normal life. He will never have independence. He will never have control over many of the basic bodily functions most of us take for granted. Dylan will need a caregiver 24 hours a day for the rest of his life. As parents, you do everything you can to protect your child. You trust the doctors and hospitals to help them, not harm them. And when something goes wrong because of preventable mistakes, your entire world becomes about trying to grieve, to give your child the best life possible under circumstances you never chose. We saw accountability for Dylan right away because when medical providers and corporations cause harm, they should be held responsible, not just for our family, but to help prevent this from happening to another child. Our attorney has been fighting for justice for Dylan for nearly 10 years. 10 years of court dates, legal battles, emotional strain, all while caring for a child with profound lifelong needs. And the truth is, there is no such thing as true justice in cases like ours. No amount of money can undo the damage that was done to Dylan's body. No legal outcome can give him back the life he would have had. But accountability matters. It matters because it helps families afford their care their loved ones will need for the rest of their lives. And it matters because it sends a message that patient safety is not an option. We all deserve to be safe when we are trusting doctors. When laws make it harder for harmed patients to find legal help, families like mine are the ones who suffer. These cases are already difficult and expensive to pursue. If the system tips any further in favor of insurance companies and large hospital systems, many families will never even get the chance to get their day in court. This isn't about punishing doctors, it's about making sure that when preventable harm happens, patients and families aren't left alone to carry that lifelong consequence without support or accountability. If we truly want fewer lawsuits, then we should focus on preventing harm in the first place. Safe staffing, better oversight, systems that prioritize patients, not profits. When care is safe, families don't end up in court. Families like mine did not create the healthcare workforce shortage. We did not cause the system's problems. We are simply trying to survive the consequences of a preventable medical mistake. All we are asking for is the chance to seek justice, to care for our son, and make sure what happened to Dylan is taken seriously and that it does not continue to happen to other New Mexicans. Thank you all for listening to our story.
And to round out our speakers, we have Atza Chavez.
Good morning. My name is Atza Chavez. My father was Everett F. Chavez, a 3-time governor for Kiwa Pueblo. He worked here in the roundhouse along many of the folks that you see here in this building. And in 2018, he became sick. He had a pain in his stomach that he wasn't sure what was going on. He went to the hospital out of desperation, hoping that someone would help him, praying for a reprieve from the pain that he was feeling. Few suspect potential harm. We're trained to trust, to believe what we're told, to trust the people that we're asking help from. But they were not there to help that day. They racially profiled him. They thought his sickness had to do with being a Native person. It did not matter the hospital. We went to 3 trying to seek care, and they all reacted similarly. They regarded him as a drunk Native person and were not willing to treat him in the way that they should have. And the truth is that he was a victim of medical malpractice in this broken system that puts profit before health care. And I came to this work as his daughter, as an Indigenous person who was raised to believe that our responsibility to one another is sacred. When my father was harmed, our family's world changed overnight. The state of New Mexico and our country changed overnight because the work that he was doing was so important. To our communities, when something goes wrong, we don't just look away. We ask what happened. We ask who was hurt. And we ask what needs to change so it doesn't happen again. That is what accountability is. But right now, there are efforts to weaken the ways our family can hold these corporate, powerful hospitals and insurance companies responsible for the serious harm that they sometimes bring upon our communities. And the efforts that are being framed as changes are really not the solution to better health care. As Indigenous families, we know better. We already face barriers to care. We travel farther. We wait longer. We're more likely to have our pain dismissed and our concerns minimized. And when something goes wrong, we often have the hardest time being listened to. And if it wasn't for our attorney, we might not have known that we had a case. Without the funds, we don't know that other people who are harmed will have the ability to seek justice. And when families can't get answers in justice, that's when these harmful patterns stay hidden. When corporations face fewer consequences for being unsafe or being unwilling to use a little bit of money to keep their patients safe, that's when our communities, our Native families, our rural families, our low-income families, that's who feels the impact first and the hardest. Accountability is not about blame for the sake of blame. It's about restoring that balance, that hojo. It's about making sure harm is acknowledged, and when steps are taken to prevent true health care, we must stand up to prevent the people who are harming us when all we were doing was to seek care for a loved one. Without justice, harm repeats itself. Patient safety and accountability, they go hand in hand. You cannot claim to care about improving healthcare while also making it harder for harmed patients to seek justice. That makes absolutely no sense. And we really need to address these provider shortages. We do need better support for our healthcare workers. We need stronger systems of care, especially in our rural and tribal communities. And we have people like Representative Rena Sapansky, who is putting forth HB 127 or HB 172, who look to provide those solutions without giving a handout to these corporations who continue to harm us. We cannot continue, or we cannot build a stronger healthcare system by silencing the people who continue to harm us. My father deserved better care. the people behind me, we all deserved better care. And I am here in this building every day to ensure that the future is better than what the past was. Because it turns out no amount of money will ever, ever, ever replace the void left of the harm that these children have suffered. But justice, equality in care, and people over profits, these are the values that we will uphold in this state, and we will continue to fight against this corrupt system until we have those values in place. Thank you.
Thank you all so much for our speakers for being here today and sharing their stories. As we wrap this up, I just want to finish with a couple of last things. Behind every statistic is a very real person. There are the faces of what happen. These are the faces of what happens when safety is not a top priority for our healthcare system. Right now, there are powerful interests spending lots of money on pushing policies that will make it harder for families like these to seek justice. They are trying to limit accountability when corporations cause harm, and they are doing it simply to hoard more profit. What it does is shift more power to insurance companies and hospital corporations and away from patients and families. I'm going to wrap it up with this. We were just in a House Health Committee this morning where many of these folks got to share their story as well. HB 99 was discussed. It passed 7-3 with an important amendment to hold multi-billion-dollar corporations accountable for the harm that they have caused our families, and all while protecting doctors. 3 Republicans voted against that bill because of that amendment. We must get very clear about what we are doing here. Are we trying to pass policies that are going to fix our healthcare system, or are we trying to give multi-billion-dollar corporations a pass? Thank you for joining us, and many of the speakers here today, including the ones in the committee this morning, will be available for individual interviews. Thank you so much, and another round of applause.